I'm Dr. Thomas Rocchio. I practice foot and ankle reconstructive surgery in Allentown, Pennsylvania. What I'd like to show you in this video is some of the unique features of the SEAL small rail external fixation system. When we look at this model, a lot of what I want to show you is demonstrated. This system is one of the first systems that can adopt the pins first technique when it comes to small rail system. There is the 360 degree ability of the car sitting on the rail device. There is a 60 degree range of motion inside a unique collet fixation, and there is also an additional 180 degree component that's obtained with the pin fixation component of the car and the rail fixation component of the car. In this model, we see that this pin can be placed in many different angles. What can also be done is this can be reversed to throw on the bottom of the rail system, and this can also be spun to give additional position, extending more proximally but still fixated on what we'll be holding as the distal portion of the rail. To give you an example of where this rail system can be used in application, quickly, we have a Lapidus model showing transosseous second metatarsal fixation. What we see in this model is we see excellent converging pins proximally, but due to anatomy, the need for a parallel pin structure medially. Interestingly enough, we can still adopt a converging pin structure on a metatarsal because of the ability to come dorsal on the car system on this rail and also plantar with the second pin, so we can get a converging but also separating these pins by 1 to 2 centimeters as is desired. Another example here is either of fusion of the hallux MTPJ or arthrodiastasis for distraction, and this has a very similar parallel design, but also showing parallel with converging components in several planes. The last model I would like to show is this model in the rear foot for triple arthrodesis, medially TN and subtalar joint compression, lateral CC joint and subtalar joint compression. Some of the interesting components that can be seen here include the addition of the 90 degree variation of the pin component to what fixates the small rail to the car for perfect anatomic fixation of a navicular that many times can be tricky if you have a wafering of the navicular after saw resection, or if you have an anatomic structure that does not allow for significant space between the navicular component and the talar component where you would like compression. This device offers the ability to actually slide the car distally and angle the pin proximally, catching excellent purchase across that navicular and allowing an increased 1 to 2 centimeters of available compression upon this rail system. The last thing I'd like to show you when it comes to the rail system is that it is fully integrated to work with the circular fixation system with a unique fixation component that applies on this rail that can act as a multi-planar strut. For example, here, holding the foot plate component to the tibial component, and in this one last structure, demonstrating midfoot, forefoot correction upon a static rear foot and tibial fixated device. Again, I'm Dr. Thomas Rocchio. I hope this video was informative. If you have any other questions or would like to speak to a representative, please contact the SEAL local representative in your area.